Well, how do they come up with that? The other thing we're going to discuss is different laboratory values may have different results depending on where you're located maybe or the time of day. So there are some things that can affect normal values of laboratory test results. And then we're going to take most of the time to focus on a thing called the white blood cell count and the differential. And we're going to look to see if there's inflammation or infection. I bet you remember from anatomy and physiology that white blood cells assist us in fighting infection or inflammation. And I'm going to teach you how to interpret that white blood cell and the differential values when you look at them. So if I do my job well when we're done, you should be able to do those things. So where do we get this concept of normal? Well, I bet most of you have seen this item called a bell curve. And when we do laboratory test results, we take the average or the mean, plus or minus 2 standard deviations, and if you look at the percentage of people that involves, about 96% of people will fall out within the normal range. So when they determine normal laboratory test results, they've sampled so many people that they feel comfortable saying, if we sampled 1 million people and we take 95.5% of those, or almost 96% of those, and we call their value range normal, we should find everyone except these other 4% that are kind of the outliers. That's not to say that I couldn't have an abnormal test and be normal, or have a normal test and be abnormal. So there are some false positive results, meaning it shows I have something when I don't, or a false negative test, it shows me I'm normal when I'm not. But we feel pretty comfortable if we say, you know what, on any given laboratory test, 96% of people should fall within a normal range. Those people that are outside those limits, those 2% above and 2% below, we're going to call them abnormal. Things that can affect laboratory test results. So there are some items, like a pregnancy test, that are best done in the morning. There are other tests, if we were looking at the concentration of your urine, we might collect it all day long. So there are some tests that we want to sample frequently. There are other tests, it doesn't matter what time of day we sample them. There are some tests that are affected by the time of day. If you think about that pregnancy test, if your urine's kind of concentrated all night long as you haven't gotten up and gone to the bathroom, it's going to have the highest level of the hormone that we're measuring. So as we go through the next few weeks of this class, what you're going to be introduced to is a variety of different laboratory test results. For the most part, they're going to be focused on systems, like we're going to talk about tests that evaluate the gastrointestinal system, tests that evaluate the urinary system. This week we're going to look at the blood system, and we'll also continue that for weeks 2 and week 3. Alright, there are some laboratory test results that are affected by where you live, and probably the most common one of these would be the oxygen level when we do an arterial blood gas. There is 21% oxygen everywhere in the world. However, if I climb to a high altitude, or I live at a high altitude like maybe Denver for example, there is less partial pressure. There's less pressure for that oxygen to drive into my bloodstream. And so there's some values that are affected by a geographic location. There are values affected by diet. When we talk about the level of ketones in your system, if you were eating a lot of just plain and simple proteins, if all you're eating is proteins, you might have extra ketones in your urine. If you are exercising when the person comes to take your blood sample, can you imagine that might affect that area of your arm where they take the sample, and that might be different than what's happening in the rest of your body. So the amount of exercise or activity you do, or doing some sort of exercise or activity, not realizing that that might affect your lab results. I'll bet all of you have probably had the experience of being told you need to fast for laboratory test results. And I'll bet some of you forgot and ate. And unless someone explained to you, hey, the reason you need to fast for this test is eating could affect the results, like maybe a glucose test. It may make it look like you have diabetes when what happened was you actually ate instead of fasted for the test as you should have. So activity, diet, medications that we take, if you take any medications or have access to looking at something like that in a magazine, they will always have a section that says medications that might interfere, or the test results that these medications might interfere with. So if I'm on steroids, it might make my blood sugar high, for example. If I have stress, as you can imagine, and if you have taken anatomy and physiology, you remember all those different hormones and chemicals that are released when we have stress. So this is just a short list of the many things that could affect laboratory test results. And the takeaway message from the last two slides is, one, there are some people who have abnormal test results when they're perfectly normal. It might be due to something like this. There are some people who have normal results when they do have something wrong with them. And so the best thing we can do for that is, let's combine tests. And I like to think of us as we're looking at laboratory test results and we're kind of putting the patient information with that. And that's the one thing we really don't have the luxury of in this class. I don't have a whole bunch of patients that I can parade in front of you so that we can ask them questions and look at them personally. So we're going to mainly be focusing on just laboratory test results, when if you were in the clinical facility, you would actually be looking at the patient and the laboratory test results together. And those two things combined help us make a really strong diagnosis. In the meantime, though, what do? Well, we combine different laboratory test results. So let's imagine that we have a 15-year-old male who came into an acute care setting or into his doctor's office, and he's complaining of right lower quadrant pain. So can you remember what's located in your right lower quadrant? So we divide that belly into four squares. And if you feel right above that right hip, that area is where you have your appendix. So it's probably likely that this young person, who probably doesn't have a previous medical history, has possibly appendicitis. The test that we usually get to check for appendicitis is we measure your temperature, because appendicitis itis means infection or inflammation. So the person does have an elevated temperature. They have no other history of illness, so it would be important that we distinguish between this patient who maybe had no previous medical history and another patient. What if this would have been a baby who was born premature and had problems with their intestines being twisted? Maybe that's what they're experiencing again, is something with their intestines. Now we know the patient had no previous medical history or illness, and their white blood cell count is elevated. And white blood cell counts, as we'll talk about today, elevate with inflammation or infection. So now we've got a patient complaining of the pain that typically accompanies appendicitis. They have fever, which typically goes with appendicitis. It's not likely that they have some other cause for these symptoms. Their white blood cell count is elevating, meaning they have inflammation or infection. And maybe the only other test we might do is an ultrasound of that area, but then we've just charged you more money to do a test when we think we already know the diagnosis. And so in this case, they did diagnose appendicitis in this young man. What if we have someone come in with chest pain? Well, I'll bet all of you know that if somebody has chest pain, it could be symptoms of a cardiac involvement. So some sort of heart attack. We call those myocardial infarctions. So the EKG, an electrocardiogram, and we'll have a whole section, a whole lecture where we talk about tests of the cardiac system, so you don't have to know those yet, but a lot of you may be familiar with these terms. An electrocardiogram is put on the patient, and it shows changes that happen. There's different electrical changes that happen when a person's having a myocardial infarction. They also did a blood test and look at the amount of enzymes that are present in that blood, and those enzymes are specific ones we look at to elevate if you've had a myocardial infarction. And so they diagnosed that the patient did indeed have myocardial infarction. So they had a heart attack, or they were having a heart attack. But we're combining those things. So one other piece of introductory information with this lecture: it's not going to be necessary typically to memorize normal values. In this day and age with computer-based systems, it's pretty easy that when I have a lab result, there will be a section I can click on in that screen that will tell me normal results. When I'm looking at a paper report, and there are still some that come to us in paper form, when I look at that paper report of the laboratory values, it will have a column that has the normal values. So it's not necessary for you to memorize the values of normal laboratory test results. Because we're dealing with, in the hospital, we're dealing with patients who are very young and very old, it's necessary for me to focus in on the most common patient we'll be seeing, and that's the adult patient. So we're going to talk, when we talk about these laboratory test results, I'm going to be referencing them for adult patients. And adults in hospitals are considered to be patients who are 12 on up. So today's topic is white blood cells then. And white blood cells help us identify whether there's infection or inflammation present. And as you look at the normal range, and there will be facilities who use slightly different normals, but 5 to 10,000 is an easy number to remember. And this is one of those tests that's probably used so commonly that you'll get used to memorizing some of these just because you see them so commonly if you're in a clinical setting. The white blood cell count is usually reported as a decimal, and I'll show you that on a lab report. Leukocyte is the medical term for white blood cells, so part of this class is to reinforce what you've learned in medical terminology, or to introduce you to some of those common terms, or to review them for you. So leukocytosis and leukopenia, I want you to pick which one of those means a low total white blood cell count, because that would be an abnormal condition, and which of these means a high one. So leukopenia, which one does that refer to? Well, leukopenia means a low white blood cell count. Because they use the word leuko, they're referring you back to that term leukocyte, white blood cells. This person, a leukocytosis designation in a patient's chart, would mean they have an elevated white blood cell count. And both of these are abnormal. That's why we have a range that says, remember, 98% or 96% of people will fall between 5,000 to 10,000. There may be people who are lower than normal. That may mean they're not fighting infection or inflammation very well. Maybe their body has given up. There are other people who will have one that is too high, and the good news is at least their body's responding, but that may indicate that they need help, or that the body's not responding, the body's response is not being effective. So this is what a white blood cell count would look like if it comes to you in paper format. And it's going to look pretty similar on the computer. In the computer, the difference would be you're probably just going to see the column and the name, and the color of this would be different if it was abnormal. For this lab, can you look at this test and figure out how they're telling you normal results? So I want you to find me, where's the column that tells me normals? There's a column that tells me the units that they use when they describe that test. There's the column that tells me the name of the test, and there's a column that tells me the results. And find how they've designated what's normal or abnormal about this patient's laboratory test result. So if I look here, I see lows and highs, and it tells me down here a designation. L is low, H is high, and an asterisk is a critical value. And in a moment I'll talk about critical values or panic values. We're going to focus on a piece of this test. This entire test is called a complete blood cell count, because we're looking at white blood cells, red blood cells, hemoglobin, hematocrit, mean cell volume, mean cell hemoglobin, mean cell hemoglobin concentration, red cell distribution width, and if you're trying to frantically write those down, don't. They'll be in your notes for next lecture. So we're going to focus, and I guess I'll just continue with these names here: platelets, neutrophil percent, lymphocyte percent, monocyte percent, eosinophil percent, basophil percent, and leukocyte percent. We're going to focus on the white blood cell and the portion of the CBC called the differential, this piece down here. So in your notes that you have, would you find the section that talks about those different cell types? It's going to mention neutrophils, and it's going to talk about mature neutrophils and immature neutrophils. And while you're finding those, let's also look at just the overall white blood cell count. So we're going to focus today on the overall white blood cell count and interpretation of the differential. This lab uses 4.3 to 10.9. Remember on the previous screen it told you that a lot of times these are reported as a decimal. They expect that you will be able to interpret this, that you will know K means 1,000. So this patient, the normal range is 4,300 to 10,900, and this patient has 9,300 cells that are white blood cells. So this person's white blood cell count is within the normal range. When I look down at their differential, their neutrophil count is actually elevated. And so that's one advantage of doing the differential is the total white blood cell count, if that's all I would have looked at, it said the patient was normal. But the differential tells me about the specific types of white blood cells. So this is all white blood cells lumped together. Here's the specific types of white blood cells, and the neutrophils are elevated. The lymphocytes are low. The monocytes are within their normal percentage range. Eosinophils is within its normal. Basophils is within its normal range, and leukocytes are within its normal range. And you look at this term leukocyte, well, those are cells that they couldn't classify as being one of the above. So they're just saying, you know what? There are some that the computer or the person who reviewed the slide couldn't specifically say they were a neutrophil white blood cell or an eosinophil white blood cell. They just said there's some extra white blood cells that probably should be given credit somewhere. A computer can be taught how to count white blood cells and differentiate them from red blood cells. And if you look at this slide, this is a good example of our blood. So if I go back to the complete blood cell count, and we're going to focus on red blood cell count next week, but look at this. Red blood cell count, the label is millions. For white blood cells, it was thousands. So as we look at this slide, can you see millions of red blood cells? And I bet you've seen pictures that shows them kind of looking like a donut. What is the key difference between white blood cells and red blood cells that would allow a computer or a person to sit down and look at this slide and tell which ones are which? Because even you, being a novice, can tell some cells look different. And the difference is white blood cells have a nucleus. And because white cells have a nucleus, we can teach the computer that if a cell has a nucleus, count it as a white blood cell. Now when we do a class next week, kind of keep that in mind because I'm going to give you one exception to that rule. Can you see though why they would call this one a segmented neutrophil? And so if you have your paper in front of you that talks about neutrophils, there are two types of neutrophils. There are band neutrophils, which are sometimes called stabs, most commonly designated as bands. There are segmented neutrophils or mature neutrophils. Some people call them segs. And do you see how the computer could tell the difference between a segmented neutrophil or one that's maybe just all joined together? With the white blood cell differential, it's going to tell us of the white blood cells what kinds are present. So in your notes it gives you more detail on these. Neutrophils, would you look and see what kind of infection are they going to elevate with? So white blood cells in general elevate with infection or inflammation. We also saw though that there's a normal range for low. That below a certain range it can become abnormal. And so that tells us the body could maybe not respond appropriately, or maybe it can't respond appropriately. Or maybe the patient's body has just been overwhelmed with the infection or inflammation and now it's kind of giving up. Well, with neutrophils, they primarily elevate with bacterial infections. And there's some terms that we get into when we talk about the differential, and you may see in a patient's chart it says they have leukocytosis. So do you remember that meant an increased white blood cell count with a right shift? Or it may say leukocytosis with a left shift. Well, when these used to be reported on a paper sheet, kind of a spreadsheet looking thing, if there were segmented neutrophils, they were recorded towards the right side of the paper. So somehow that designation, that term has kind of followed through where we call it a right shift. And if the bands are elevated, we call it a left shift. Well, if you look at your notes, it talks about segmented neutrophils. Because they're mature neutrophils, they usually are present in higher amounts when we have an ongoing or kind of a chronic type of bacterial infection. So if we take that person who had appendicitis, those symptoms probably only would have been there for about 24 to 72 hours. If it's less than 3 to 5 days, we call it an acute process. And if you have an acute infection, the thing that will elevate is your bands. So bands are immature neutrophils. Do you remember the body part that produces white blood cells? So think back to high school biology or your anatomy and physiology class. What is producing those white blood cells? So I hope you're answering out loud. They should come from the bone marrow. And if my bone marrow is healthy, I should be able to make white blood cells. Well, can you think of some patients who don't have healthy bone marrow? Patients who are having bone marrow transplants, patients who are on chemotherapy or radiation therapy, their white blood cell counts are going to be very low because their bone marrow is being suppressed with either chemicals, chemotherapy, or with x-rays, radiation therapy. When we kill cancer cells, we kill rapidly growing cells, and unfortunately, rapidly growing cells are also white blood cells and red blood cells and platelets. So if my bone marrow doesn't work, or if I'm suppressing it, I'm some sort of treatment that's suppressing it, I'm going to have decreased counts. In this case, the bone marrow should recognize I have an infection, and initially it's going to release those immature soldiers, those immature things to go to battle and fight the infection, So I'm going to have an increased band count. So what does a left shift mean? A left shift tells me that the band neutrophils are elevated. What are band neutrophils? They're a type of white blood cell. Typically, elevation of the band neutrophils means an acute bacterial infection. What does a right shift mean? A right shift means a chronic infection or inflammatory process. What do you think bands grow up to become? They grow up to become segs. And there's even, if I think of these as immature and mature, there's even some premature neutrophils called metamyelocytes or promyelocytes that you'll see on a patient's differential sometime. And those would be similar to saying there's a left shift. If I have a lot of those immature or really premature neutrophils, then it tells me the bone marrow is thinking it needs to release a bunch of those to do something, and that doing something would be fighting a bacterial infection. So, to review, we're going to look at some other slides. I'm going to continue on with this white blood cell differential, and you've got this piece in your notes. So we said neutrophils usually mean there's a bacterial infection if they elevate. What is usually present if lymphocytes elevate? And we distinguish between lymphocytes and leukocytes. Lymphocytes are a type of white blood cell. Leukocytes is the term that means white blood cell. So lymphocytes elevate with viral infections. Monocytes elevate typically with fungal infections. Eosinophils elevate if I have an allergic reaction, like an allergic reaction to food, or if I have allergic asthma. If I have an autoimmune disease like lupus or arthritis, like rheumatoid arthritis, then I have an elevation in my eosinophils. And basophils usually elevate if I have blood cancers or maybe a condition like hypothyroidism. Alright, so here is a white blood cell count, and the test, this whole test is called a complete blood cell count. For this lecture, we're going to focus on the white blood cell count and the differential, and this says manual differential. The designation manual differential on the differential result can tell you that it was because the person who ordered the CBC also ordered the differential. Or it can say automated differential, that it automatically created a differential because the white blood cell count was abnormal. So can you imagine you could teach a computer that if the white blood cell count is abnormal, automatically put out a differential so that we can look at the specific types of white blood cells. That's what automated could mean. Manual could mean that a physician ordered a CBC and a differential, or it could mean that manually somebody sat down and looked at the slide. In this day and age, it usually means that the doctor said, I don't care what the white blood cell count is, I also want the differential. So if you're taking orders from someone and they say, I'd like a CBC, it would be appropriate to say, would you also like a differential? So commonly they go together, CBC and differential. The differential then, we looked at it and it tells us about the types of white blood cells present, so let's look at what's wrong with this patient. Their overall white blood cell count is too low. And this is for a baby. Look at their normal results. They average 10 to 30,000 white blood cells, and they do that because their immune system is very weak to start with. They have mainly cellular immunity, so they need a lot of those white blood cells. So this is for an infant. We go down here, and it says their segmented neutrophils are low. Their band neutrophils are low, so we don't have a right shift or left shift because left shift meant band neutrophils elevated. Right shift meant segmented neutrophils elevated. We don't have any of those metamyelocytes or promyelocytes, those really immature bands or immature neutrophils. We do have an elevated lymphocyte count. We have a normal monocyte count, and we have some nucleated red blood cells. And those nucleated red blood cells, do you remember we taught the computer that anything without a nucleus or with a nucleus was a white blood cell? And so someone double checked this and said, wait a minute, there were some nucleated red blood cells that snuck into that sample. Because they had a nucleus, they were counted as white blood cells, so they will have reduced the total white blood cell count. So do you see up here? They adjusted for those nucleated red blood cells and cells that were very large. So it was initially reported as 5.6, and you know that that means 5,600, because here's our label. 5,600 cells, and now they've adjusted it to 5,400 cells to more accurately get rid of those nucleated red blood cells and these large cells. So cell size is another way that computer could be taught to recognize white blood cells and red blood cells. So what's wrong with this patient then? Are they effectively fighting the infection? So if I look at the total white blood cell count, I'd say no. They don't have enough white blood cells to help them fight that infection or inflammation. Is the body putting out new cells? And we'd like most of those cells to be neutrophil. If you look at the percentages here, and you look at the percentages on your lab notes, the section on differentials, can you see I had those listed in an order? Neutrophils are the most common type of white blood cell. They primarily fight against bacterial infections, but they help us fight all types of infections. So we want lots of neutrophils. The next most common cell type we have is lymphocytes. We want a lot of those. So I want you to think about this baby then. Are they able to fight infection or inflammation very well? No. Their white blood cell count's too low. Is their bone marrow putting out a whole bunch of new neutrophils? No, or I'd have a lot of bands, those immature neutrophils, which are going to, within a few hours, grow up and become segs. They do have a lot of lymphocytes, so try to remember without looking at your notes, what causes lymphocytes to elevate? What kind of infection? Well, typically lymphocytes elevate when we have a viral infection. So let's put together, without having the patient in front of us, which is not ideal, this baby probably has a viral infection that's gone on long enough that they have an elevated lymphocyte count, but their overall white blood cell count is starting to fall. And so that's what we're seeing reflected here. They don't have a good ability to fight bacterial infections, do they? Because they have a low band and seg count. The monocytes are within their normal, so we're primarily probably dealing with some sort of infection or inflammation, not because the white blood cell count was high, but because it was low. That can mean that we have some sort of condition like that. Okay, let's practice with this one then. So orient yourself to the test, find where your normals are, find your results, and now we're back dealing with an adult again with that kind of 5 to 10,000 range for normal. So is there evidence of infection or inflammation just based on the white blood cell count? And I'd like you to answer yes or no. How did you make that determination? If there's inflammation or infection, it will typically cause the white blood cell count to elevate outside its normal range. Or if the infection or inflammation is kind of starting to overwhelm the body, we would see that decrease. So based on the white blood cell count alone, I don't see evidence of inflammation or infection. But when I come down to the differential, and this differential is reported as percentages Here's my neutrophils, here's my bands, here's my segs. So up here they put them all together, and then they split them into the mature ones and the immature ones. I don't have any of those promyelocytes or metamyelocytes. I do have anisocytosis. So they have some that are kind of a different size and a different color. They have an occasional one of those. We look here then, what's going on with the patient? Well, their neutrophils are within the normal range, except if I split it out into the bands and the segs. Look at this, the bands are elevated. Do you remember the name of that? The term we might see in a patient's chart or the physician's writing, it might say there's a left shift. Do you remember a left shift means that you probably have an acute infection? And what are those bands going to grow up and become in the next few hours? They'll become segs. So if we report this laboratory test in a few hours, we may have less bands and more segs as those have grown up. Or what if the condition is still happening? We're still going to have a high band count, and now we have a high seg count. So do you see how an acute infection could lead to a chronic infection? And we might have both a right shift and a left shift. Right now we just have a left shift. The bands are elevated above their normal. A right shift would be the segmented neutrophils are elevated above their normal, and they're not yet. The monocytes are elevated. Maybe you have a fungal infection going on as well. So sometimes we can have more than one type of infection, and not always does it guarantee that if the monocytes are elevated that you have a fungal infection. It's just a typical pattern that when lymphocytes are elevated, we have maybe a viral infection. When neutrophils like segs and bands are elevated, you probably have a bacterial infection. So that's a common pattern. Okay, here's another one. So we've got a whole bunch of those asterisks, and do you remember what asterisks meant? It meant panic value or critical value. Look at this person's white blood cell count. This is an adult. 5 to 10,000 basically is their normal type of white blood cell count. This person has how many cells? What does that decimal mean? How many cells does this person have when they should have 5,000 to 10,000? They only have 500. If you look, all of the cell types that come from bone marrow, red blood cells are low, hemoglobin's low. Look at these counts. So what's wrong with this patient? This is the typical kind of sample that you'll see on a patient who's receiving chemotherapy or radiation therapy for cancer treatment. Somebody that's having a bone marrow transplant, or we're killing their bone marrow so that they can get ready to have a bone marrow transplant. Could you see why they would have neutropenic precautions on this patient's doorway? So I'd go to this patient's room and it would say neutropenic precautions. They're telling me this person doesn't have a very good ability to fight infection at all. They're going to have them in isolation. They're going to make sure that visitors who come to visit them, that we don't have somebody that's sick. They may make them all wear a mask even if they think they're healthy. They may go to the point where they say they don't want any fresh flowers or fresh fruit taken in that room because of the types of things that they might take into the room. The bacteria and viruses, those things might take into the room. The person is going to receive their food on plastic, so it's not going to be reused silverware, even though it may have gone through a dishwasher and been cleaned very well. They're probably going to use plastic to feed this person on, because then it can be taken out of a package that hasn't been used by someone else. So their white blood cell count, they only have 500 white blood cells. Very, very low, very high risk for infection. Their neutrophils, and you look at this. This is 15% of 500, 84% of 500, 1% of 500, and then right here they've done the numbers. So they have 100, right? Because here this is number, pound sign is numbers. They took 15% of 500 and they got 100. They took 84% of 500 cells and they got 400 cells. So they've done the math for you here, and they've told you the percentages here. The numbers for this patient are basically going to be garbage because we're taking percentages of such a small number. But I do see the lymphocyte count is elevated, and that may or may not indicate an infection. So just because your white blood cell count isn't elevated doesn't mean you don't have infection or inflammation. The other thing I want to take a minute to talk about is this panic value or critical value. So we're talking about it in reference to white blood cells, but it's any laboratory test that is immediately life-threatening. And when we have that, they're not just going to rely on a computer to get the results up there. They're going to send an immediate report, and they're going to list the person's name that was notified of that result. So the lab is going to call up, they're going to talk to a live person and say, we have an immediately life-threatening or a panic value. So when we see the reference panic value or critical value on a patient's chart, or usually the color, say for this one, might be a bright red in an electronic format, we know that something is immediately life-threatening to the patient, and they would list who was designated and who was called. So do you see this one? And it's for a test with cardiac enzymes, or this one's for blood sugar too. It says critical values were called to Dr. Bethina in ER, and then elevated enzyme levels were called to Dr. Knight. So they actually have written on this piece of paper or in the computer system who was notified of those, so that there's an absolute chain of knowledge so that they can say, no, this person knew about those results. Okay, let's look at a lab test back here for just a minute, because I wanted to do one last thing. Here's those percentages. 69% of the 8,800s are neutrophils. 14.9% of 8,800 white blood cells are lymphocyte counts. That's how they're calculating those. And when one cell count goes up, one cell count goes down. And the reason that happens is this. Look, these are percentages. And what do you think if I added all these together, they would total? So there's a section in your notes that talks about relative and absolute changes. And what that means is, especially with a differential, where we have a value that has to total 100, mathematically, what happens to one value when another one goes up? So let's say my lymphocytes, let me find that test result back here. Sorry to make you dizzy on your screen. Let's do this one. Here was a patient who had an elevated lymphocyte count. This means 73% of their 5,400 cells are lymphocytes. When this goes up, another value has to drop. And the ones that get impacted primarily are these two ones that are present in the highest numbers. So if I were to ask you the question on a quiz this week, what is the most common type of white blood cell? You should be able to use those percentages to help you remember it. So of this list on the differential, what is the most common type of white blood cell? Well, it's a segmented neutrophil. And if I combine segs and bands together, look at that. They represent a significant portion of the white blood cells. So most white blood cells are neutrophils. What's the second most common type of white blood cell? It's lymphocytes. And so if the lymphocytes elevate, it's likely that the segmented neutrophils or the neutrophils are going to go down, because these percentages, the way math works, total 100. Which of these is the condition I should be worried about then? Am I worried about this one because it's low? Well, yeah, because those help me fight bacterial infections. Am I worried about this one because it's high? And the only way we would really know what's happened with this patient is if we had a series of CBCs done on them, or if we have the patient that we can look at. But what we could do is we could default to what's the normal reaction of the body. If your body has infection or inflammation, what should your body do? It should release white blood cells. So we're going to say, and if you look at the section on relative and absolute, we're going to interpret this as the lymphocyte count elevated, and because of that, the neutrophil count appears to be decreased. The total white blood cell count may or may not be decreased, but because one cell type increased, another cell type has to decrease, and because these two are the most common type of white blood cell, they usually influence each other. So I'm concerned that the lymphocyte count is elevated. That may mean the person has a viral infection. This baby has a viral infection. Because of the elevation of the lymphocytes, it makes it appear that the neutrophils are lower than they should be, and that may or may not be correct. Is this baby at risk for an infection? Yeah, because they have too few white blood cells. So relative and absolute, the relative means it happened in relationship to something else. We think there's a relative decrease in the neutrophils because there was an absolute increase in the lymphocytes, and that's one way to interpret it. And the way we made that interpretation is based on the body's normal response would be to produce white blood cells. So I'm going to post this video. I will have a new video posted at least by each Friday, and sometimes I'll get those done early. If you'll click on the course menu buttons, I'll have one that will be titled Watch Your Video Lecture. If you want to get an A in the class, there's an easy way to do that. Have your notes so that you can kind of follow along with those. If you want to review the PowerPoint slides, I'll have those posted, but that's kind of a moot point because you can just watch the video and select the slides that you want. You're going to then take a quiz within a week. So Friday to Friday, you'll have a week to take that quiz. I'll post the deadline with each quiz that I put up there. And the way you access those quizzes is the course menu will be titled, there'll be a button titled Weekly Quiz. When you take that quiz, you won't find out immediately what your answers, which ones are right or not. You will know how many points you scored on the quiz. And you have the option to take the test 2 times. And I take the highest score so you have nothing to lose. So if you take it the first time and you're not happy with your grade, kind of review and take it again. I'll post instruction with those quizzes that tell you you're welcome to use your notes because I'm focusing on not memorization but interpretation of those laboratory test results. So I'm more than happy if you want to use your notes. All right, I will get those up, and the way you'll find out the correct answers for the quiz is in a week when everyone's had a chance to take it. I'll reopen that quiz, and you can get in as many times as you'd like by clicking on your score, and you can see your answers and correct answers. So I hope that answers the questions you may have this week. This video might be a little bit longer than the normal ones because we had all that introductory information, but I will try and keep those a little bit shorter in the future. If you have any questions, you're always welcome to contact me. Thanks. Now I got to figure out how to turn this off. There we